knowing that I'm prone to ulcers, well, pressure sores, I made sure that I was sat on a cushion to try and prevent pressure sores from happening. Unfortunately, that didn't work, and I ended up with a pressure sore on my left leg, and obviously the result of being obviously in here. So I think it was probably certainly within a few days of being up here, of going from a normal, what you would call a normal bed mattress, to a Dolphin.
So we found that with the Dolphin mattress, it helped us to be able to have the patient in a certain position. For example, in Paul's case, to be off the area that had been operated, and at the same time not get another pressure ulcer on the side that it needed to be more laying on.
I suspect it's pretty much like a waterbed, because I can feel it moving around. So if I move, then the mattress will sort of compensate. It's a clever bit of kit. I'm guessing there must be sensors inside the mattress and takes pressure away from one area and moves it to another one. So you feel supported, but you're always taking the pressure away from the area that it needs to be taken away from.
And if it was on a normal mattress, it would have been really much more difficult and probably would take longer time. And instead of repositioning the patient every 2 hours, he would probably need to reposition every hour or even half an hour, to be always getting circulation to the part that he's on. Yes.
In terms of comfort, yeah, it's very comfortable. Even when I have sort of laid on the injury, because I've got a graft site there, well, a donor site there and a donor site here. And the good thing is you can actually alter it to what you feel is comfortable. So it's getting the balance right, which is very easy to adjust. And I can adjust it from laying here to sitting in the chair, because you've got a chair setting and you've got a bed setting.
In Paul's case, for example, we have the mattress and the cushion, and it's really easy to attach to one or the other. It's very easy to use, basically.
Well, it gives you basically a bit more freedom, because you don't have to sit in bed all day. You can sit out in the chair, which gives you a bit more where you can have a bit of a change.
So if it wasn't for that, we could have been taken much longer to be able to get to the stage that we are now, and he's ready, medically fit to go on. So every patient, even if we have a patient that comes in without pressure ulcers, that has a very, very, very high risk of pressure ulcers. Patients that have problems with mobility, paraplegic patients, then we would consider a Dolphin mattress to prevent pressure damage. And more than that, it helps to be able to have beds for other patients that need to come into the hospital. And there is always a shortage of beds, and patients with cancer and big problems getting cancelled because there are no beds in the hospital. So obviously, it's a big difference being able to have the Dolphin mattress to reduce the time that these patients need to be in hospital. On the Kinmont unit, all the staff members have been involved in Paul's care because he's been with us for quite a long time. And although our work is absolutely amazing and helping Paul on any ways we can to get a sooner discharge, surely having the Dolphin mattress has supported that.
It certainly played a part in it, definitely, because it's helped to keep the pressure off. Rather than sitting on or laying on a conventional mattress, which wouldn't give you the kind of pressure relief that this does. I'd certainly recommend it for anyone who's got similar sort of injury to what I've got. So.